So hello guys, let's have a look at the syphilis screening concepts, okay? So this is the timeline and this is the titer axis, okay? So as the patient gets infected, first of all, just like any other viral infection, we have the IgMs, they become positive, and then later after the acute infection spike, they become negative, right? Now, the important thing is that the first specific thing to become positive is the FTA-ABS, which is surprising to students because they say that, well, we screen with VDRL, don't we? So how come this become positive first? But this is how it is. Okay, so the FTA-ABS becomes positive and then it stays positive throughout life. Okay, so this is very important, that lifetime positive. Okay, so the lifetime positivity of FTABS is going to stay there. Okay, and after this, FTABS was going to become positive at around 2 weeks. Okay, but after that, a VDRL becomes positive, and VDRL, now this is very important, that it's going to fall and become negative if the patient is treated, and it's going to plateau and stay positive if the disease is untreated. Okay, but remember that its positivity comes after the FTABS. Okay, it's in this direction. So first we have this and then we have this. Okay, so now the question is that a patient comes to you with VDRL negative and FTABS positive. What is this? Okay, so the students are like, VDRL is negative, so the screening test is negative, which means that this cannot be syphilis. But this is the problem, they don't know the chronological order of the serology. But now you know that. So now you know that this means that this is an acute early infection because the FTABS is positive and the VDRL has not become positive yet. So the patient is having syphilis. Or if this is also positive, then this means that this is, the course of infection. This is, the patient is now infected and it's not treated yet because the VDRL is positive. And then we have the TPHA antibody. It becomes positive also. And about this is that also stays positive throughout the lifetime. So if you have the both, so this is the whole thing. Okay, this is depending on the treatment. If the patient is treated, it becomes negative. If the patient is not treated, it stays positive. But FTABS and the TPHA antibody, they both stay positive throughout the life once a patient gets syphilis. Okay.